Hi everyone, it's me, Melanie, your IVF nurse, and today I'm going to be doing a video on the Puregon pen, and this is strictly Puregon, so it won't be discussing mixing with any other medications, but it's just to get you familiar with using your Puregon pen. Puregon can be used for minimal stimulation, so in say a modified natural cycle or IUI cycles, or IVF cycles. Usually doctors will have their preferences. If you've done previous IVF cycles and have been successful with the use of Puregon, then the doctor may recommend that as well, that you use it again. So when you go to your clinic and you're picking up your medications, what your Puregon pen is going to look like is this, okay? So when you get it, it's going to come in a kit, and it's actually quite lovely. It's just like a hard plastic container, but when you open it up, so Puregon pen, when you open it up, it's actually got nothing in it, okay? So what you'll need to do is purchase the cartridges. So this pen, to administer the injection, should come free because you're going to be spending an awful lot of money on the cartridges. So the cartridges, they come in 300 units, 600 units, and 900 units, depending on your clinic and how often they prescribe Puregon, may determine what they have in stock, if they carry the medications in stock at all. Sometimes they write prescriptions and you go to your pharmacy and it gets ordered in. However, so if you are getting prescriptions, you want to make sure that the cartridges are ordered as well as the pen to administer the medication. Many times I've seen that pharmacies will dispense only the cartridges, which do come with the needles. However, you need to load the cartridge into the pen in order to use it. So what you do is once you've got your pen, and when you get it, like I said, it comes empty. Is take your cartridge, and like I said, it comes in 300, 600, and 900 units. What you're doing is taking your cartridge out of the box. It will be in a plastic wrap. The thing is that this cartridge is made of glass. So when you're using this cartridge or loading it into your pen, you want to make sure that you're not doing it over or standing up over a hard surface. If you drop it and it cracks, there goes, I always refer to these medications as liquid gold. So you're going to lose hundreds of dollars, and depending on the cartridge amount, possibly $1,000. So you want to be careful when you're handling this. It is multi-dose, so you're going to get more than one injection out of this, depending on your cartridge size and your daily dose. But if you're doing, say, 300 units a day and your clinic gives you a 900 unit cartridge, you're going to get 3 shots out of that. So keep that in mind. Now, when you're loading your cartridge into your pen, what's going to happen is, let's put the cap down. So you've got this part only, and you're going to take the metal part of the cartridge going in first, okay? If you're not paying attention and say you put it in metal part outwards, or the last part going in, and you try to screw the pen together, it won't let you do it. So it's almost kind of dummy proof. So metal part going in first into this yellow part of your pen, screw the pen together, and you want to make sure that your rectangle and triangle, as you'll see here, are together, okay? Once you've got that, you can dial your dose. So with this here, if you're looking closely, you can see your pen always reads 0 when you're about to dial your dose. You'll see the IU, and then there's a little point right there pointing at the 0. Each click that you do is about 8 units. So that would be 25. If my dose was 50 units, then I'm going all the way to the 50, okay? Hopefully you can see that. So that IU and that little point is right at the 50. If I were to go one more click, say I'm not paying attention, it's no longer at the 50, it's one above. So what you would need to do is dial it all the way to the end, reset it back to 0, and then carefully dial it to your 50 units or whatever your desired prescribed dose is. So 50 units in the window. That IU and that point should be right at the 50 units. Once you've confirmed that you've got that, what you're going to do is take an alcohol swab. New needles every time. The needles come in the cartridges, so they do not come with the pen itself. The pen is just the pen. The pen actually comes with a great little resource book that helps you log your medication. Also gives you all of the troubleshooting, how to load your pen, if something's going on with your pen, how to troubleshoot. So it's a great little resource book that you can access. It comes with the pen itself, the empty pen. When you're getting your cartridges, your needles come with that as well. Your disposal bag, which will be a gray bag that looks like this, will actually have your alcohol swabs in it. Take your your alcohol swab or cotton swab with alcohol. You're going to clean the top. This is where the needle is going to attach. And you want to remember that this pen here, once you poke your new cartridge, it's only good for 28 days. You want to use a new needle every time. So peel that off. And then you're just going to screw this on until you get resistance. Okay. And then you're going to remove the larger cap, remove the green cap or the clear cap. There's a small inner cap always. And then you're ready for the shot. Okay, now if it's your very first time, you could prime your pen, and in that booklet it'll tell you that. There's not a lot of air that's going to go into you. It's minuscule, so if priming your pen really kind of freaks you out, then it's not going to do anything to you if you don't prime the pen. As a nurse, I feel bad kind of saying that, but don't get fixated on the really, really tiny air bubbles or anything that you might see in the cartridges or any of the medications that you're doing. They're small needles, subcutaneous injection going into the tummy or the thigh. So I'm going to actually poke myself so you see me doing an injection. What you're going to do is take your alcohol swab. If you find that you need to do any kind of prep in order to get the injection done, so a cool compress on the injection site, 10 minutes, make sure you're wrapping your ice pack in something. You don't want to apply it directly to the skin. You may damage the skin. So wrap it in something, apply it to the skin about 10 minutes just to get it a little bit numb. Some people will choose to apply a cool compress after the injection. It's entirely up to you. The more kind of tummy fat you have is ideal, only because some people will say that it burns or stings less if you can get a good pinch of skin. So what I'm going to show you is myself. So here I'm just going to clean the area with alcohol, and there's my belly button, 2 to 3 fingers away from my belly button. So let me go here, clean the area with alcohol. I've got lots to pinch, and what I'm going to do is just take a couple breaths, and I'm going to go straight in. Okay, now in order to inject the medication, you do need to push this. So you can push, if you find it difficult to do how I'm doing it, you can always let go and use your other hand and push. And then what you're going to do when you're done, you're going to just remove. If you find that you've got a little bit of bleeding, what you can do is take the alcohol swab, and I don't even see where I went because I'm not bleeding, but you can always just apply pressure wherever you did your shot. Now, what is key, I'll just fix myself up here. What is key is that once you're done your injection, you remove or dispose of your needle properly. So not in regular garbage. You want to use the larger cap, and what you're going to do is put it down on a flat surface. So and then you're just going to go like this, so it's recapped. And then what you're going to do is unscrew. You're going to unscrew, and then this part goes into your medical waste bag, capped, because this is plastic, and needles will puncture through this if they're not capped. You're going to take your cap to your pen. Cartridge remains in because it's a multi-dose pen. and you're going to find that when you're doing your shot, in that booklet that you get with your pen, with your case, you can log your daily dose to help keep track. So once you've got your shot done, recap, into the fridge it goes for storage, or store it as per your clinic instructions. I hope you found this helpful. Please feel free to email me at yourivfnurse@gmail.com. You can also check out my website, www.yourivfnurse.com. You can follow me on Instagram at yourivfnurse, or you can subscribe to my YouTube channel or comment down below. Thanks for watching.